Imagine lying on an operating table, fully aware of what's about to happen. The dim flicker of oil lamps casts shadows across the faces of people holding sharp instruments. There is no anesthesia, no modern painkillers. Just you, the pain that's about to come, and a few strong hands pinning you down so you don't thrash too much. For thousands of years, this was the reality of surgery, until the arrival of anesthesia in the 19th century. But before that breakthrough, humans had to find many ways to endure one of the most intense experiences imaginable. Pain is one of the body's most powerful survival mechanisms. When tissue is damaged, pain receptors, nociceptors, send electrical signals through the nerves to the spinal cord, and then up to the brain. Your brain triggers an instant reaction. You pull away, your heart rate spikes, your blood pressure rises, and stress hormones like adrenaline flood your system. It's a warning system designed to keep you alive, but in surgery, pain was unavoidable. And without anesthesia, every procedure was a brutal battle against it. Ancient civilizations tried to dull the pain with methods we now see as crude, even dangerous. The Egyptians and Greeks used strong alcohol to push patients into a semi-conscious haze. Some cultures relied on opium from the poppy plant or extracts from cannabis to calm the nerves. Ancient China, physicians developed a mixture called mafizin, a blend of cannabis and herbs, to induce mild numbness. But none of these could match modern anesthesia. Patients were still awake. They still felt the pain just slightly less, or through the fog of intoxication. When pain couldn't be eliminated, surgeons had to outrun it. Before anesthesia, the most prized skill wasn't precision, it was speed. Amputations often lasted just 1 or 2 minutes. Surgeons like Robert Liston in the 19th century became famous for removing a leg in under 30 seconds. But speed came at a cost: mistakes, infections, and high mortality rates. Some pain control techniques were downright extreme. Ice or snow could be applied to numb an area temporarily. Tourniquets could cut off blood flow so a limb lost sensation. In some cases, patients were rendered unconscious by cutting off their air supply, a practice as dangerous as it sounds. All of this underscored one truth: for most of human history, medicine fought an unwinnable war against pain. The turning point came in the 19th century, when scientists began experimenting with gases that could temporarily render people unconscious. In 1846, in Boston, dentist William T.G. Morton publicly demonstrated the use of ether to anesthetize a patient for the removal of a neck tumor. Spectators, many of them physicians, were astonished. The patient didn't scream, didn't thrash. This was the birth of modern anesthesia, and it changed medicine forever. Today, anesthesia is a sophisticated science. An anesthesiologist doesn't just put you to sleep. They carefully control the depth of unconsciousness, block pain signals, and maintain vital functions like breathing and circulation. There are 3 main types: general anesthesia, which renders the patient completely unconscious; regional anesthesia, which blocks pain in a specific part of the body, like a spinal block during childbirth; and local anesthesia, which numbs a small area, like for dental work. Each requires precise dosing, timing, and continuous monitoring. The exact mechanism of general anesthesia is still one of medicine's great mysteries. We know these drugs act on receptors in the nervous system, silencing neurons and preventing pain signals from reaching the brain. Some agents, like propofol or sevoflurane, boost the activity of GABA, the brain's main inhibitory chemical, creating a calm, quiet neural state. But why this can reliably and reversibly turn off consciousness is still being studied. Anesthesia's importance goes far beyond pain control. It has transformed the very scope of surgery. Before anesthesia, operations were mostly limited to quick trauma repairs, tumor removals, or amputations. Today, we can perform open-heart surgery, organ transplants, joint replacements, even brain surgery with the patient awake, but pain-free, procedures unthinkable in the pre-anesthetic era. The history of pain management is a story of human ingenuity, risk, and persistence. It shows how far people were willing to go from plants and alcohol to freezing temperatures and experimental gases to escape one of life's harshest sensations. And the next time you drift off into that smooth, dreamless sleep before surgery, remember less than 2 centuries ago, that was still impossible. Anesthesia isn't just a medical technique, it's proof of what science can achieve when guided by compassion, turning surgery from an ordeal of agony into a path to healing.